The world's ambition to create a sustainable world is outlined in the SDGs, particularly in terms of health and responsible production. Tuberculosis, or TBC, has always been a major focus on this issue, with 10.8 million people infected and 1.25 million deaths every year. This makes TBC one of the leading causes of death from infectious disease globally. Although treatment is available, challenges in its implementation still become problems.
Patients have many complaints regarding TBC treatment. Oral administration makes it difficult to swallow the medication, while injections can cause fear in patients and produce hazardous medical waste. This is especially the case for elderly patients and children.
Given this challenge, there is a need for more effective, easy to implement, and acceptable TBC treatment innovations, especially for underage patients.
To overcome these problems, I'm Muhmammad Lingga, Padantya, and my friends
Muhammad, Izzat, and Kamal from Bandua, Kota Malang, Indonesia, proudly present to you
RIDDLE-Patch, dissolvable microneedle patch with Rifampicin-Chitosan microparticles for tuberculosis patients. RIDDLE-Patch is the latest transdermal drug delivery method utilizing dissolvable microneedle patch technology. Patients simply just apply the patch into the skin and press it with their finger. The Rifampicin-Chitosan microparticles will automatically enter the epidermal layer in the skin and diffuse into the bloodstream.
Once in the bloodstream, chitosan functions to protect rifampicin from dissolving prematurely in the blood plasma. This ensures that the microparticles effectively reach the target cells. These microneedles are precisely designed and simulated using COMSOL Multiphysics 5.6 software before fabrication. This ensures they are strong, effective, and pain-free.
Based on the needle simulation test conducted on stationary and buckling parameters, microneedles with a height of 500 micrometer and a diameter of 0 micrometer showed the best structure with the smallest Famisa stress and high critical factors. This indicates that the needle can effectively penetrate the skin layer and withstand axial pressure well.
In the RIDDLE-Patch, we encapsulated rifampicin in a chitosan microparticles matrix that dissolves slowly and only active at the site of infection in the lungs. Based on the microparticles characteristics test, it is known that microparticles validated the functional group of C double bond C, C2O, and O2H, which indicating the successful encapsulation of Rifampicin-Chitosan microparticles. Had an interruption efficiency value ranging from 56 until 74%, and tube-shaped microparticles with an average size around 61 micrometers.
Testing of the RIDDLE-Patch characteristics revealed evenly distributed needle morphology with consistent sizes. Furthermore, in vitro drug release testing showed the best sample could release 40.5% of rifampicin within 48 hours.
The effectiveness of RIDDLE-Patch shows regulation of live white blood cells that is close to the number of cells in healthy mice. The percentage of bacteremia shows that bacteria were reduced to 19% in the best sample.
Unlike previous microneedles that utilize hollow and hydrogel microneedles, we developed a dissolvable material, a cost-effective and straightforward production method, making our innovation safer and more efficient. This innovation also leaves no medical waste, as the needles dissolve completely in the skin. This helps target SDGs number 12.4 in reducing hazardous chemical waste.
Most importantly, this innovation directly supports SDG 3.3, which aims to end the tuberculosis epidemic. Because of the comfort, ease of application, minimal pain, and a price of only $0.46 per patch, it makes RIDDLE-Patch highly suitable for commercialization, especially for underage patients and those patients who live in remote areas. With RIDDLE-Patch, we are not only creating new technology,
We are creating new hope for million people of tuberculosis patients around the world.
this innovation is not only about efficiency, but also about equitable access to healthcare, comfort, and sustainability.
Together, let's create a tuberculosis-free future that is safe.
Environmentally friendly and painless.
Thank you for your kind attention.